So my name is Kelly Rowe. I'm a Grand Ronde tribal member that came back to the tribe about 5 years ago to fulfill the role as the Executive Director of Health Services. So I can tell you that the coronavirus is rapidly changing across the world. And as we learn more about it, we are implementing different techniques to make sure that there's prevention, there's safety for people, and that we're having enough resources available for people to take care of themselves if they get into situations where they can't get out due to social distancing or any of the other techniques that are being recommended. The best thing that people can do to protect themselves is to wash their hands frequently and to clean surfaces and to make sure that if anybody has symptoms around them, that they self-monitor to make sure they don't get symptoms also. The best thing we can do to protect our families is to make sure that we are practicing social distancing. And this is something as a tribe that's very difficult because as a people, we are always there for our family and our friends. Now what we're asking is that people do it electronically, either do it by a telephone or computer, but to not be close physically to people so that it doesn't potentially transfer the virus. The best thing we can do to protect the community is the same tactics. We want people to stay home, only do interactions via phone or computer, anything that has the ability to stay distance from people. This allows people to either recover from the symptoms or to not get the symptoms, and it's really important so that it doesn't continue growing. I want people to know that the coronavirus is very similar to the flu. The symptoms are fever, coughing, and sneezing. And if somebody has those symptoms, we want people to call their provider. It's really important during this time to be there for each other. As a tribal community, we are about taking care of each other, and we don't want that to stop. We just need for people to be cautious about it and do it more through telephone or through email, other types of communication that don't require face-to-face. I have 2/3 of my immediate family that are high risk for coronavirus, and so I'm practicing these techniques myself, and it's very hard. So I understand people are concerned about not being able to be around their immediate families. Please know that it's the best thing we can do to protect each other and our loved ones and our community.